Yes, please start it.
So, welcome to this 33rd edition of Thursday Musings. We have been running non-stop for past 32 weeks, and this is the 33rd. I'd like to welcome Professor Dr. Tophan Pati sir from Cuttack. He is the chairman of the program. We all know him too well, and he doesn't like a long introduction. So I'll just hand over to Tophan Pati sir. I have saved 30 seconds.
Thank you, Alif. I will be saving some seconds, but not as much as you, because I have to introduce 4 important persons. Pawan, please move on. We have got Dr. Amrit Patjoshi, the moderator and co-organizer along with me. He is the professor of psychiatry of High Tech Medical College and his chief consultant in Amri Hospital and Healing Touch Clinic. He is a direct council member of IPS and is the editor of Odisha Journal of Psychiatry. Welcome, Amrit. And we have with us from Lucknow, Dr. Aleem Siddiqui, who is the director of the Healthy Mind Neuropsychiatry and Behavioral Sciences Center, Lucknow. He is a visiting professor of psychiatry in Lucknow Medical College and Hospital and GSPM Medical College, Kanpur. He is a past direct council member. His term just ended this year. He is a guest faculty of Amity University and the finance secretary of IMA Lucknow branch and also of IAPP UK chapter. Welcome, Amrit and Ali. And now I have the job to introduce our esteemed chairpersons, Dr. Rajesh Kumar from Patna. He did his undergraduate education from Patna Medical College and Hospital, and his post-graduation was from AIIMS New Delhi. He then did his research official job at AIIMS New Delhi from November 4 to 2005, then joined in as assistant professor in EVAS and worked as co-investigator and principal investigator in many ICM and NACO-funded research projects, has published more than 50 guide and articles in various indexed national and international journals, and worked as co-guides in around 25 MD theses and 15 MPhil dissertations, written 7 book chapters, and also reviewed many books and MD theses. Member of various policy groups on de-addiction, certified and accredited trainer for HIV counseling, and teacher and topic of drug abuse in children and adolescents, has got a Scroll of Honor Award from IME, National Branch for contribution in the field of psychiatry in April 2015. He is currently the Dean of Research at IJMS Patna. With this, we have got with us the versatile Dr. Rajesh Kumar. Welcome, sir. Our next, and we have got Dr. R.K. Sukla, who is the HOD Psychiatry in VSS Medical College, Burla. He graduated from SC Medical College, Cuttack. He was the ex-nodal officer of West DST Center, MHI, Cuttack, with the Center of Excellence. He is a member of Central Level ARC under WCD Government of Odisha. He is the ex-treasurer of IPS Odisha State Branch. He is the recipient of various awards for public service. He is practicing psychiatrist for last 2 decades, 18 years. Welcome, Rajnikant, Dr. Rajnikant Shukla. And with this, I hand over the meeting to the esteemed chairpersons. Your stage, please.
Thank you, sir.
Thank you, sir, for your kind introduction. And I think Dr. Rajnikant is around.
Yes, sir, I'm there.
Yes, I think I will introduce the topic, and I think you can introduce the speaker, Dr. Sharma.
Yes.
So
Yes.
First, I will take over this part of introducing the topic.
Sure.
Through all the esteemed panelists, and I think all the esteemed members of Thirst Musing, and which has been the brainchild of Tophan sir, and I think very great psychiatrists Aleem and Amrit. So when I was actually invited to be for this, I was feeling, I think, sense of pride and privilege also, but also feeling a bit nervous about this topic of sharing this mindfulness, because I think as an psychiatrist for last more than 23-24 years, I have never been to this clinically. I can say I have never practiced mindfulness, but I did, and recently last year more so I have done reading regarding this. And I think we all know, I'll not take much of the time about this mindfulness. Mindfulness has been the buzzword, particularly last, you can say, a decade. Although we know this mindfulness-based therapy started way back in the era of Buddhism, and I think Western actually started practicing more than Eastern part of the country, and I think Eastern part of the globe also. So lately, I think when in 1979, this Jean Cabot and other people, Siegel and their colleagues, they started this mindfulness-based therapy. So it has come a long way in last 30, 40 years. And now mindfulness therapy is not only practiced by people who are healthy, but even it has been found very effective in people having some psychiatric disorders, even for physical and mental disorders both. People actually practice mindfulness for initially treating hypertension and diabetes, but lately started with depression and now coming to bipolar, and now we have this evidence also for OCD. When I was going through the research evidence, still I can say like lots of papers are there. And I think somewhere I was feeling that clinical experience is more far ahead of the clinical research, systematic clinical research in this area. And definitely, I think with the speaker like P Sharma having vast experience in psychiatry, and I saw his CV, so definitely he will be doing great job in next uh, half an hour, 1 hour, whatever time is being permitted. So with these words, I now hand over to Dr. Shukla for formal introduction of the speaker.
Thank you,
Dr. Shukla.
Dr. Kumar. Am I audible?
Yes, sir.
Yes, yes, you are loud and clear.
Thank you, Dr. Kumar. Good evening, everybody. Best wishes on this day of Mahashivratri. And I would like to thank the team of Dr. Tophan Pati, Dr. Aleem, and Dr. Amrit for this opportunity to chair this important session. Our eminent speaker for today is Professor Mahendra P. Sharma. He is presently the professor and head of the Behavioral Medicine Unit at NIMHANS. He is originally from Rajasthan. He did his education, started his education, completed his BSc from Rajasthan University, went on to do his MA in psychology from the University of Udaipur. Then he moved on to NIMHANS, where he completed MPhil in medical and social psychology, along with PhD in clinical psychology from NIMHANS. He joined as assistant professor of clinical psychology in the December of 1984. He has worked in the field of adult psychiatry, community mental health. At present, as I said, he is the head of the Behavioral Medicine Unit, which provides psychotherapeutic services in the form of cognitive behavioral therapy, including the third generation behavioral therapies for psychological disorders as well as other related medical conditions. His primary area of interest is research on the interventions referred to as the third generation behavioral therapies, such as mindfulness-based therapies, integrated cognitive behavioral therapy, acceptance and commitment therapy, and MCT, metacognitive therapy. He is a prolific publisher and researcher. He has over 80 papers in national, international journals, books, and has presented more than 20 papers in national, international conferences, workshops, and symposia. With this introduction, I hand it over to Dr. Parjoshi or Dr. Aleem to take it forward. Thank you.
Thank you, Shukla, sir. So we have a very eminent speaker, one of the top persons in the country. So it's a privilege to have him here. So sir told that let us not have a PowerPoint very formal. Let's have a very in tune with the theme of the Thursday musings. He wanted a absolute musings to occur. So I and Aleem will be throwing some questions at sir, and maybe sir will be asking a lot of questions, answering the questions. And if you have any queries, any doubts, you can please put it on the chat box. We'll take the questions after the our question answer sessions. We have a set of questions which we have prepared for sir. So sir, are you ready, sir?
Yes. I hope I am audible and
Yes, sir. Yes, sir.
Yes, sir. Yeah.
Alim, can you put the spotlight on sir, if possible?
Yeah.
So we'll start with the theme of the today's talk. So can you
Yeah.
just please elaborate what is mindfulness actually? We hear a lot about mindfulness. What is it actually?
Yeah, as far as mindfulness is concerned, basically this word is a rough translation of Buddhist approach, that is Vipassana. So Vipassana means to observe in a special way. Like the word Vipassana comes from two words, V plus Passana. So V is means special, like Jnana, and if you add V, you prefix V, then it becomes Vijnana. Or like Suddha, and if you prefix V, then it becomes Visuddha. So specially purified, that is the water. So in the same way, V is a prefix and Passana means to observe. So it means that is to observe in a special way. So what is the, you see, what we understand by the mindfulness is the, like basically it is awareness, you see, expansion of the awareness, and basically it comes from the meditative tradition, and basically it involves to be present, to be present in the present moment, and with the purpose. The purpose is that is you voluntarily want, I mean, that is what is, and you watch whatever is happening within yourself and around yourself. So in a sense, it is not to control your mind. I mean, that is basically it is to understand the functioning of the mind. I mean, that is the, and when one understands the mind, a great understanding develops. What has been termed as the, you see, consciousness, or what we can say now in our mental health terminology is the metacognitive awareness. So in the mindfulness, I mean, that is, it is an approach. One aspect is the formal practice, and the other one is the informal practice. Later on, we will be talking about that one. So basically, mindfulness is to live in the present moment. And if we say in other words, then basically it is attention without tension. That is attention without tension. That is so. As far as its definition is concerned, Kabat-Zinn defines it as a paying attention in a particular way with purpose. Purpose is mean that is you want to observe yourself and in the present moment, and non-judgmentally. So let me elaborate these terms which are there. I mean, that is the, when we talk about the you see, present moment, you see, it doesn't mean that okay, one have to suppress the thoughts of past or thoughts of the future, or the any images or anything which is related with the past or the future. Basically, to be aware that right now, what is happening to me, that is, I am thinking about the past, being aware, and also being aware that right now, at present moment, I am having these thoughts or these images or these feelings. So being in the present moment does not mean that it restricts you from from the thoughts or the emotion or images from the past or related with the future. So this is to begin with. If you want me to elaborate, I will certainly elaborate on this.
Sir, I wanted to know, being present moment and also not being away from other moments. So, are we talking about having a greater cognitive reserve? Would that be a right term to use? We are talking of higher order cognitions.
No, means basically like it is basically to watch the mind or to watch the cognitions. When one begins, then one starts with observing whatever is happening within oneself, and the attitude requires to be of the let go. I mean that is, and like there are other two terms. I mean there is metacognitive knowledge. We all know that sometimes we get more thoughts, sometimes we get less thoughts. What I think about this particular topic, that is our metacognitive knowledge. Then metacognitive awareness is when one is aware. I mean that is one is mindful and observing whatever is happening during the formal practice of the mindfulness meditation. So on that, so when this metacognitive awareness enriches, then naturally the end result is the metacognitive insight. Metacognitive insight means that is you start taking whatever happens within yourself in an easy manner. You don't become serious about your thoughts or your emotion. You take that this too will pass. I mean that is. So more and more, so from metacognitive perspective, one comes to learn that whatever my cognitions are, I mean that is whatever my thoughts, emotion, feeling, images, they are nothing but the passing mental events. So that is the metacognitive aspect of it, and they don't require analysis or the importance. So in a way, mindfulness approach is different from the traditional cognitive therapy or cognitive behavior therapy, where there is an emphasis of bringing about change in the cognitions, the content of the cognition. While in the mindfulness, it is how you relate with your thoughts or being aware of them and not giving significance to them is the key aspect of mindfulness approach. So like it is in a way, what you think about your cognition, what are your beliefs about your cognition, that is related with the mindfulness, that is the metacognitive aspect.
Sir, do you think that it means that we have to be detached from those thoughts and feelings?
Yes, I mean that is distancing, or what we call decentering, and that is, or defocusing, or other word is diffusion, because generally what happens is that is as a normal human being, we identify with our thoughts. We don't see them as a separate events. So what you are saying is correct in a way. Being detached, and for detachment, distance is needed. I mean that is to there is a observer who is also aware of what he is observing. At the same time, he is also aware that is what is happening to him.
Okay, thank you.
Thank you, sir.
Amrit,
Yes. Yeah.
Amrit, can I ask one question to sir?
Yes,
Yes, please.
Yes, sir. Sir, I think you used a very great statement that attention without tension. I like that, and it's very
Yeah,
simple to comprehend for most of the viewers here.
yeah,
What I know about mindfulness, ki being in present moment without judging the situation. So definitely, I think. Can you explain a bit about how we can achieve that attitude of not judging the things? Like
yeah. So uh, you see, at the face value, mindfulness appears easy, but it is not easy. Hmm?
yes,
The thing is, like we are all conditioned to judge. Our very language is judging, like the polarities. I mean, that is, it is all dialectics. I mean, that is good or bad, right and wrong, moral or immoral. I mean, that is so. Naturally, I mean that is the like the non-judgmental aspects involves when one starts practicing mindfulness, then there naturally there will be judging will occur, but at the same time you have to be non-judgmental about judging. I mean that is, which means that is when you become aware that you have judged something. I mean that is, you have said it is right or it is wrong, it is moral,
yes, yes.
immoral. Uh, it's okay. I mean, that is, be aware that is, I have judged. So, being non-judgmental about judging also. Sir, I hope I have answered your question.
No, rightly said, sir. But why I was just thinking, it will be
Ah,
very difficult to achieve this status of not judging your own feelings, experiences, and emotions sometimes. Because I
ah,
think
so in that the formal practice, it starts with the awareness of the breath. I mean, that is the in the formal practice we do, and then and gradually moving to the awareness of body sensation and the
yes,
body,
yes,
and then the sounds, then thought, and then feeling. That is. So the
yes,
initially, like in the intervention, we generally start with the body scan meditation. So in which person lies down and one remain aware of his breathing, and at the same time taking like it also involves the component of imagination, and so different part of the body, one takes the breath there, and then the way the breath goes out, then uh, the whatever tension in that body part is, that is going with the outgoing breath. So naturally, I mean that is the initially it is difficult, but with the practice, uh, uh, certainly you can enhance the quality
achieve.
of awareness.
Yeah, so what I get is we have if you are able to be non-judgmental, non-attached, and you are sort of floating in a different zone away from the current emotions and problems, then it would be a sort of mindful approach. Am I correct in saying so? Or
I mean, basically, I mean that is being aware that this is whatever is happening within myself, and uh, as far as possible, I mean that is like say, I mean that is the whenever one will find that the mind has wandered, which is a perfectly normal phenomena as a human being. So when one realizes that my mind has wandered, without criticizing oneself, gently return back to the awareness of either breath or the body or the thoughts or the emotion, whatever you are focusing your attention on.
okay, thank you, sir. Amrit.
So definitely,
So,
sir. Uh, if I understood it correctly, like mindfulness is basically extension of meditation. I can say, people when they meditate, it's an extra effort at attending to your emotions, your feelings and needs, and observing without judging that. So as you said also in the beginning of your presentation that it's a part of meditation only, mindfulness meditation and
Yeah,
vipassana.
let me, that is like the 2500 years back, Buddha revived this meditative technique. Its references are even the older texts like Vigyan Bhairav Tantra, in which Lord Shiva, it is a, today is a very good coincidentally Mahashivratri. So in Vigyan Bhairav Tantra, there are about 112 techniques he tells to Parvati. I mean, that is small techniques. I mean, that is which are different ways of being aware. For example, if you are going, because he refers on that time when there were bullock carts. So now even if you are going in the car or train, just feel your body, allow it as it moves and observe it and be settled. Like small sutras are there. So basically, mindfulness is related like the synonym of the meditativeness, I mean, that is. So there are two parts. One is the like the formal practice, I mean, that is the, and then another is the outcome. So generally we say that is ki I'm doing meditation, but meditation basically involves moving towards non-doing and going from doing mode to the being mode, just to be whatever is happening and observing.
Thank you, sir.
Thank you.
So, we will now stick to the topic that is mindfulness in OCD. So I'll come to that topic, sir. How to practice mindfulness in OCD, and what's its relevance here, sir?
You see, when we talk about the relevance of mindfulness, we require to understand the certain mechanism. So one of the mechanism which involves in the mindfulness is the acceptance. And mindfulness approach basically encourages people, and it is the one of the several foundation of mindfulness approach is to accept whatever is there in that is. What happens is people with OCD find it difficult to accept their unwanted, so-called unwanted thoughts or the obsessions, I mean, that is. And research has also proved, I mean, that is key, the way the people react, the significance and importance they give to their obsession is responsible for the genesis of the OCD. Normal people also get similar kind of thoughts or obsessions, but after a particular time, they don't give significance and importance to them. So content-wise also, and by frequency-wise also, research has, so the acceptance is the one of the main thing. And second thing is the mindfulness provides an opportunity for the exposure. As all of you must be aware about the ERP approach. So the behavior therapy or cognitive behavior therapy approach is basically one of the key components of different techniques which are involved is the exposure. And another thing is that is mindfulness minimizes what has been termed as experiential avoidance. So as a human being, we have tendency to not to experience the negative emotions. And that is, so therefore, mindfulness helps people to accept their emotion and bringing down. I mean, that is, it also gives the opportunity for the exposure. Automatically, if you are sitting or at any time, any obsession is occurring, then it encourages people to experience the whatever distress caused by the obsession. And third thing is that is like earlier already I have explained, that is the metacognitive component. So what happens when a person observes gradually more and more, then he comes to realize that these thoughts are nothing but they are more passing mental events. So these are the main components. Apart from that, practice of mindfulness also helps people to deal with day-to-day stressor. So we all have observed that when there are stressors, the OC symptoms increases. And also the purpose of mindfulness is not to bring the relaxation, but initially one may not become relaxed, one may become more disturbed, as we see in the clinical practice of the ERP, that symptoms increases. So in similar way, in the beginning when one is observing whatever is happening within oneself, but mindfulness also leads to the relaxation. So that is common with all relaxation techniques. So the mindfulness is also being practiced as a relaxation training technique. So,
Sir, in your view, do you think that mindfulness therapy is equivalent to in terms of efficacy of ERP, which is, I think, far more established form of therapy?
I mean, present studies are, I mean, that is showing, I mean, that is like what we, like the reference list which I have sent to Dr. Alim also and Dr. Tophan Pati, which will be circulated. So we have completed a randomized control trial, and we find that it is other one which is not yet published. The what is published shows that is though it may not be superior, but it is equally effective. That is the one one research finding is, and then it gives us an opportunity to another technique for those. Particularly in predominantly obsessions, I mean, that is, we have found it very effective. When we integrated it with the ERP, then we have observed better results. But research-wise, still we have to that it is superior than the traditional ERP. We don't have the research evidence for that.
Thank you, sir. Thank you.
Sir, how is it combined with ERP? Because isn't it that they are in slightly different directions?
I mean, that is in the mindfulness integrated ERP, what we do is that is, let me first explain. I mean, that is the what we do is that is like our module. I mean, that is the which is so. First is the like as a like we starts with the psychoeducation, and the purpose is of that psychoeducation is to make the patient understand obsessive compulsive phenomena in terms of cognitive behavioral perspective plus mindfulness perspective. And we start with what works in OCD and what does not work in the OCD. So like there is a concept of creative hopelessness, I mean, that is. This term comes from the acceptance and commitment therapy. It is Hayes' term, which means that is making the person understand the way he is trying to overcome this problem of OCD is not working. So the first thing which we make them understand that is, if you are having expectation that I should not get obsessions, unwanted thoughts, this expectation doesn't work in the OCD. Occurrence of thought is not in our hand, but what is in our hand is how to relate or how to deal with them in a right way, and that right way we are going to teach you. Second component is involved with the distress caused by the obsession, and there the cognitive error of the emotional reasoning involved. So we tell that is to get distressed, to get upset, either by the frequency of the obsessions or the content of obsession is really not required. It is something like your habit. So, and the emotion which is experienced by the person with OCD is very intense, and we make them aware that is over the period you have to realize and you have to talk to yourself that this much distress is not needed. This distress is not needed, or this much distress is not needed. Then we teach them also that suppression of the thoughts doesn't work. I mean, there is a rebounds effect. Like if you hit a tennis ball, table tennis ball, more you forcefully hit, more it will jump. So in the law of reverse effect occur. So any effort or any strategies to suppress the thoughts don't work in OCD. Lastly, we present for the patient, make them understand that compulsions are nothing but self-discovered remedies to deal with the distress caused by the obsession. So initially it works, but over the period, this strategy does not work. So in the beginning, it appears very promising to the patient, and it is self-discovered. I mean, that is, some people will do counting, tapping, as we all see in the clinical presentations of the in OC patient. So we first make them aware that these are the things which do not work in the OCD. So first, that is the realization. I hope I am clear. If there is any questions regarding that, I can clarify, and then I will move to the next part of our module.
Sir, Amrit, carry on.
Yeah, Alim. So next question, sir. Sir.
So may I continue with that one? Because so this is the initial part, I mean, that is.
Yeah, sir,
and then we explain the patients the point which I just explained regarding acceptance, exposure, and minimization of experiential avoidance, and so that we explain the relevance of the mindfulness to the patients. I mean, that is key, how it is like in the mindfulness there is a concept of impermanence, which is common to different philosophical approaches or the religious approaches. So nothing is permanent except the change. So therefore, your thoughts are not permanent. Your distress is not permanent. Sooner or later, it will go by itself. I mean, there is so that concept also we explain, and then we train them in the relevant variant of mindfulness meditation, depending on the person, starting with the breathing awareness, and then moving, and then the sitting meditation, which involves all the components. And lastly, then we have what we do is that is we have a 4-point strategies whenever obsessions are occurring, and which on that time there are 4-point strategies. So so we, before that, we conceptualize, that is, we first explain the patient that as there are normal physical events like breathing, heartbeat, sweating, in the similar way, there are normal mental events like planning, daydreaming, fantasizing, and when we are asleep, then dreaming